How to get your levothyroxine dose right. Finding the right dose of levothyroxine can feel like a puzzle, but with the right guidance, it becomes manageable. Levothyroxine is a synthetic thyroid hormone used to treat hypothyroidism, a condition where the thyroid does not produce enough hormones. The goal of treatment is to restore normal thyroid function by normalizing thyroid-stimulating hormone levels and alleviating symptoms. When starting levothyroxine, the initial dose for most healthy adults is about 1.6 micrograms per kilogram of body weight each day. For instance, if you weigh 70 kilograms, your starting dose may be around 100 to 1 to 5 micrograms daily. However, older adults or those with heart conditions usually begin with a lower dose, typically between 12.5 to 25 micrograms daily. This approach helps to minimize potential side effects, such as increased heart rate. After starting treatment, your healthcare provider will likely adjust your dose gradually. This usually involves increasing the dose by 12.5 to 25 micrograms every 4 to 8 weeks. This slow adjustment allows your body time to respond and helps stabilize thyroid-stimulating hormone levels. The aim is to achieve a TSH level within the normal range, which indicates that your thyroid hormone replacement is adequate. Monitoring is crucial during this process. Regular blood tests to measure TSH levels and sometimes free thyroxine levels are essential. These tests are typically done every 6 to 8 weeks during the adjustment phase. Once your levels stabilize, your healthcare provider may extend the time between tests. It is also important to take levothyroxine consistently, ideally on an empty stomach, about 30 to 60 minutes before breakfast. This timing helps maximize absorption. Certain factors can affect how well levothyroxine works. For example, taking it with calcium or iron supplements or certain foods can interfere with absorption. If you switch between different brands or formulations of levothyroxine, do so cautiously, as even small differences can impact hormone levels. Additionally, medical conditions, medications, and pregnancy can all necessitate dose adjustments. As you continue treatment, the maintenance dose usually remains around 1.6 micrograms per kilogram per day, but this can vary based on individual needs. Most people do not requiring doses above 100 micrograms daily, and doses exceeding 300 micrograms may suggest issues like poor absorption or noncompliance with the medication. In summary, getting your levothyroxine dose right is a personalized journey that involves careful initial dosing, gradual adjustments based on symptoms and blood tests, and attention to factors that affect absorption. Always consult your healthcare provider before making any changes to your medication regimen.